Welcome to Let's Talk in observance of Black History Month. My name is Tanya Smith, and I'm the Community Relations Coordinator with Gift of Life Motel. Before we get started, I'd like to share two videos, so take a look.
Chi Eta Phi Sorority Incorporated is a professional organization for registered nurses, student nurses, and nurse practitioners, both male and female alike, representing many cultures and diverse ethnic backgrounds. Chi Eta Phi was founded on October 16, 1932, at Freedmen's Hospital in Washington, D.C., now known as Howard University Hospital. During that time in history, Black nurses were limited to working at segregated hospitals in menial positions, with little to no room for advancement. As a result of these concerns, registered nurse Eileen Carrington-Ewell, along with 11 other courageous Black registered nurses, collectively known as the 12 Jewels, chartered the Alpha chapter of the organization. The organization's foundation was based on two specific purposes: elevating the plane of nursing and increasing interest in the field of nursing. Guided by the motto, Service for Humanity, the sorority has programs focusing on health promotion, disease prevention, leadership development, mentoring, recruitment, retention, and scholarship. The organization is thriving, and today membership has grown to over 8,000. There are more than 101 graduate chapters and 41 undergraduate chapters located in 33 states, District of Columbia, and St. Thomas, U.S. Virgin Islands. Since the beginning, Chi Eta Phi Sorority Incorporated has clearly established itself as a service organization that strives to confront the problems of African Americans. We continue in the tradition of our visionary leadership by providing meaningful service initiatives and moving beyond the traditional approaches to improve our communities through education and health promotion.
This program is sponsored by Gift of Life Motel and Chi Eta Phi Nursing Sorority Incorporated. This evening's presentation is entitled African American Healthcare Warriors Part 2. We'll take a brief walk through history, learning more about how African American nurses blazed the trail. We are excited to have Dr. Alexandria Ballard Sims, who will share this important history. After her presentation, we'll have Q&A, closing comments, and a few announcements. But our moderator for this evening is Ms. Janice Hampton. Janice is a semi-retired nurse celebrating 33 years of nursing. Congratulations to you. She serves as the president of Lambda Chi chapter of Chi Eta Phi Sorority Incorporated, which you've just learned about, is a professional nursing organization. Janice is a member of Sigma Theta Tau International Honor Society of Nurses and a member of Toastmasters International. Janice has worked in various areas of nursing, but now that she's retired, she spends a lot of her time enjoying volunteering, traveling, and even fishing. Do you do ice fishing?
No.
So let's welcome Janice for serving and thank her for serving as moderator, and I'll turn it over to you.
Thank you so much. And of all the fishing I've ever done, never ice fishing. And thank you for showing our national video on Chi Eta Phi sorority. It is my honor to introduce Alexandria Ballard Sims, who will be our presenter tonight. She is a registered nurse with an incredible passion for reducing health disparities among minorities by implementing chronic disease prevention and organ tissue donation programs. She is completing her doctorate degree, Doctor of Nurse Practice, Adult Primary Care at Wayne State University, and she is expected to complete this in August of 2023. During the COVID-19 pandemic, Alexandria made an impact in our Detroit community through her work as a nurse in a local Detroit critical care unit and through providing drive-through COVID-19 testing and vaccines. For the past 3 years, Alexandria has served on the planning committee for the Gift of Life Motep Transplant Symposium. Alexandria continues to stay active as a community health educator and a coordinator of health promotion and disease prevention programs. She is also a member of service organizations, including my beloved Chi Eta Phi Sorority Incorporated, Delta Sigma Theta Sorority Incorporated, and Sigma Theta Tau International Nursing Honor Society. Alexandria looks forward to the future to spread awareness and reduce health disparities of organ tissue donations and chronic disease prevention for a healthier Detroit. I present to you our presenter, Alexandria Ballard Sims.
Thank you so much for that warm welcome. Thank you and welcome, welcome, welcome everyone today and tonight for this very special presentation. And before I get started, I just want to make sure that I send my appreciation to Gifts of Life Motep Detroit for all the support and being able to have this space along with Chi Eta Phi to be able to present some of the trailblazing nurse leaders, healthcare warriors of our time and of the past. So we will take a look back and move forward throughout time and have a discussion. And we welcome your questions, your input, your comments on the side if you have anything to share. So we will get started. Okay. And also, happy Black History Month. This is a time for us to celebrate and embrace our accomplishments, and especially our nurses, our Black nurses, educators in the field, and providers that have taken the time to impact our community in so many great ways. And for us to be able to learn, we must pay tribute to those that have paved the way. We are standing on the shoulders of giants, those that have made a bigger impact for us to be able to continue to make that impact within our community. So I want to extend that gratitude to all of our ancestors and to those that have come before us and that are here currently that have shared their wisdom with all of us here. And before we get started, a trivia question. So some of you may know, who was the first Black professional nurse in America on record? A, Mary C. Cole, B, Mary Eliza Mahoney, C, Harriet Tubman, or D, Alice Bacon. And you may also put your comment, your answer in the chat. I'll give a couple more seconds. Absolutely. Thank you, Janet, for your answer. Thank you, Larry, for your answer. It is B, Mary Eliza Mahoney. And we'll talk more about her throughout our conversation tonight. Thank you. So, the significance of Black nurses in history. We have done tremendous things to pave the way in medical procedure development and interventions, serving our country on in the Army and the military, and even integrating into the healthcare workforce. And we're going to talk more about that throughout our discussion. And we'll start with the Civil War and Reconstruction era with our first healthcare warrior of the night, Sojourner Truth, who is also well known as an abolitionist in her day, a women's rights activist who was enslaved and served as a nurse for the Dumont family. She was passionate about being a nurse for that family, and that influenced her work at the National Freedmen's Relief Association in Washington, D.C. And with that position, she also often spoke before Congress to advocate for nursing education and formal training programs for all for those that were potential nurses of that day. Harriet Tubman was also a healthcare warrior. She served as a nurse during the American Civil War and used her knowledge of herbal medicine to treat wounded soldiers on the island of Port Royal off the coast of South Carolina. And after that, after the Civil War, she was still motivated and encouraged and empowered to help those that needed support and healing. And she opened her own home for the elderly. Moving on to the industrial era, we have Mary Mahoney. Between 1845 and 1926, she was one of the first to graduate from an American nursing school, and she is known to be the first professional Black nurse in America. She was also a member of the Nurses Association alumni of the United States and Canada, and that is also known today as the American Nurses Association, which we still are, we have nurses that are involved in that nationally today. She was also involved in the 19th Amendment and was very involved in women's rights suffrage movement. And so she was one of the first women who was registered to vote in Boston. Throughout her life, she was very involved in her profession. And she battled breast cancer for the last 3 years of her life. However, she continues to be an influence and an impact for nurses and continuing to become healthcare warriors today. Jessie Sleet Scales is also known as a healthcare warrior in nursing. She was the first public health nurse and a pioneer for culturally appropriate care of that time. She was a district nurse for the charity organization Society in New York, and she specialized her services in tuberculosis, which was a very common disease at that time, like similar to COVID. But she was able to support the community, and she was recorded in an article in 1901 for reporting her caseload, including 156 calls on 41 families in a 2-month period, which I can't imagine how that could be. And we do so much work today, but to go house to house without the technology that we have, she was a trailblazer of her time. Moving forward in the 1870s to 1890s, throughout this period, we started to look at building schools and educational institutions for future Black nurses and leaders. And so in 1881, there was the first school of record for Black student nurses was established at the Spelman Seminary, also known as Spelman College in Atlanta, Georgia. We also know that in 1881, Alice Bacon was instrumental in starting the Hampton Training School for Nurses, and which was also commonly known as the Dixie Hospital. And its first graduate was Anna DaCosta Banks. Also during this time frame, Dr. Daniel Hale Williams established the Provident Hospital and Training School for Nurses, the first Black-owned and first interracial hospital in the United States, which is amazing. And because of these schools, we were able to provide access for future Black nurses. At that time, it was very difficult for women of color, men of color even, to be able to establish themselves as nurses because of segregation laws and systemic racism. So we had leaders, trailblazers within our community that built and established these schools for our community of nurses. Moving forward to the progressive era, we have trailblazer and healthcare warrior Ada Bell Toms, who was born in 1870 in Virginia. And she moved to New York City. She had an interest in speech and elocution before studying nursing at the Women's Infirmary in School of Therapeutic Massage. Once she finished her studies there, she began her nursing education at the Lincoln Hospital and Home School of Nursing. This was a school for Black women, and she graduated in 1905. And impressively, she was able to become the acting director of the Lincoln Hospital in 1906. Unfortunately, she did not hold that title of director because of policies that restricted Black women at that time to become directors. However, she was the president of the Lincoln Hospital Alumni Association. So these were some of the things that did actually happen, and unfortunately, but we move forward to be able to share this history with our nursing community so that we can learn from our past. In 1932, Chi Eta Phi Sorority Incorporated was established by Eileen Carrington Ewell and 11 nurses that we saw a beautiful video the organization was founded at Freedman's Hospital, also known as Howard University of today. And over 8,000 registered nurses, nurse practitioners, nurse educators, and nursing students in the graduate and undergraduate chapters are involved throughout the country. We have chapters also in St. Thomas, the U.S. Virgin Islands, as well as in Liberia and West Africa. And we're all guided throughout this organization, Chi Eta Phi. We're guided by the motto, service for humanity. So we are devoted and committed to providing access to health promotion, disease prevention programming, leadership development for our nurses, mentoring, recruitment and retention, and also scholarships for our undergraduate students as well as graduate students within the organization. So we continue to build and grow into a great community of nursing leaders. And we move forward with the civil rights era, which was a pivotal moment, pivotal time within our history where we saw a lot of change. And with starting with Lieutenant Della Rainey Jackson, who became the first Black nurse to enter the military service during World War II. She's also a member of Chi Eta Phi as well, and we also have a scholarship in her honor to serve our members of the sorority in their scholarship. Also in 1967, Lawrence Washington became the first male nurse ever to receive a regular commission in the U.S. Army Nurse Corps, which was a very important accomplishment to see within the U.S. Army Nurse Corps. Lillian Holland Harvey became the dean of the Tuskegee University School of Nursing in 1948 and held this position for nearly 30 years. And after that, she established Alabama's first Bachelor of Science degree in nursing program, which was very important at that time. As we know, with the civil rights and Jim Crow era, there was a lot of restrictions in education for our future nurses. And so this program offers students a strong education background with complete hands-on hospital experience during this time when hospitals were known to be very segregated. They had the opportunities to have hands-on experience locally and also out of state, thanks to Lillian Holland Harvey. Another organization that is very important to us is the Mary Mahoney Professional Nursing Organization. And this was established by Anne Foy Baker, who invited 12 of her peers, registered nurses, to a meeting at her home to meet one another and discuss ideas of establishing a professional organization. And to this day, they are a national organization that provides health promotion activities as well as service, volunteering, and leadership and mentoring programs for nurses in the field. Moving forward into the 1970s and 80s, we saw the development of the National Black Nursing Association, which was founded by Dr. Loran Sams and 15 other nurses. We also saw Hazel Johnson Brown become the first Black woman to be the chief of the Army Nurse Corps at that time. And in 1980, Dr. Bernice Finley Morton, who's also a member of Chi Eta Phi Sorority Incorporated, was one of the first Black instructors at Wayne State's College of Nursing to receive tenure. And there's also a room in her honor that I actually have class in every Tuesday. So this really makes it all come full circle to understand this history and where we come from. Also, just another tidbit about the National Black Nursing Association. There are different chapters. So the Detroit National Black Nursing Association was established in 1972, 2 years after the national establishment of the organization, by 12 charter members, including Geraldine Holtz Doby. The programs include educational seminars, workshops, mentoring students, tutorial programs, scholarships, and other ways to network with other nurses and to provide health prevention and promotion activities. They also helped to establish the first National Black Nurses Day with the support of the Detroit City Council for February 16th every year. So we have that to celebrate and to appreciate the National Black Nurse Association, along with the leadership of the president, Nettie Riddick, for her leadership in continuing to light the torch for our nurse leaders in this organization. In the 1990s, we saw that General Clara Adams Ender became the first Black woman in nurse to be appointed Commander General of an Army post, which was very important at this time in 1991. We're still breaking barriers and continuing moving forward. And in 1992, State Senator Eddie Bernice Johnson, a Democrat in Texas, was elected to the U.S. House of Representatives, who was the first nurse, Black or white, to be elected to Congress. So this was a huge stepping stone within our history, within politics. And we can see later on that we do see more nurses becoming more involved in politics after this time. Moving forward into the 2000s, in 2018, Dr. Ernest Grant, who's also a member of Chi Eta Phi Sorority Incorporated, became the first Black male nurse to be the 36th president of the American Nurse Association. And he continues to develop initiatives for diversity, equity, and inclusion. And also our very own Dr. Natrina Tate, also a member of Chi Eta Phi Sorority Incorporated, was highlighted in 2020 by Crain's Detroit Notable Women in Healthcare for her active role and her continued support in nursing education and nursing leadership as the Associate Dean of Students at the University of Detroit Mercy. And as we move forward in time, we have many nurse leaders and healthcare warriors who have paved the way and we continue to carry that lamp to provide safe care during this historic global pandemic. We can't forget to acknowledge all of our nurses, Black, white, all nurses of color, for their support during this time, and that we continue to introduce ways to educate on COVID vaccines and testing. So we continue to support our nursing leaders and our community through being able to have discussions about being safe and protecting our community. So what is next? We must advance our profession. And one of the ways that we can do that is to provide leadership opportunities within the organizations that we talked about earlier, with the National Black Nursing Association, with Chi Eta Phi Sorority Incorporated, and with the Mary Mahoney Professional Nursing Organization. We must continue to recruit nurses of color within our healthcare system. Currently, African Americans account for only 10% of the population of nurses. And so we must continue to drive forward with recruiting to be able to promote diversity, inclusion, and equity within all forms of healthcare, community, as well as in the corporate setting. And lastly, we must reflect and share our history. In order for us to move forward, we must learn how to embrace and celebrate our rich, diverse history here in Detroit and local and nationally as well within our own practice, and to share this with our colleagues and our friends and family. And my final words is to share this beautiful symbol, a Sankofa, which is an African symbol, which means in order for us to move forward, we must retrieve from the past. And so I leave you with that today to celebrate and to also motivate ourselves to continue to do the great work that we do in our community, and to share this with others that are being able to share and to build their own nursing healthcare warriors. Thank you.
Thank you. Thank you so much, Alexandria. That was an excellent presentation. You can see all the work that you put into it. I'm wondering, was there any fact in all that fact finding that really inspired you?
Yes. So there were many stories that came about with doing the research. And I like to really highlight the work that Mary Mahoney did within her tenure as a nurse, and seeing all of the obstacles that she had to go through. And many of these nurses had to go through to be able to impact their communities. They didn't just let someone to say, no, you can't do this. They found a way to break that barrier and to continue the work that they're doing.
Yes, indeed. And as you had mentioned, the one nurse, I'm sorry, I can't think of her name, but can you imagine many of the nurses are joining us tonight do home care. And as we do home care, we may have 8 patients in an 8-hour period. Can you imagine doing that many without all that we have and having in a 2-month time over 100 patients?
Exactly. I just can't imagine. I mean, I have to say that we take for granted the technology that we have, and just to be able to see the rich history that we have within nursing, with Harriet Tubman and Sojourner Truth being on the front lines of the Civil War and not having many options, but being able to put their lives on the line for those that fought for us, and being able to get our freedom. So it's very important for us to recognize all of the hard work that these nurses have done for us to pave the way.
And you highlighted quite a few nurses that have done quite a bit in the community from the past right on up to the present. Is there any one nurse that you could think of that you wish you had more time to, one more that you would like to highlight?
Of course, there were so many, and you have to forgive me, all of those nurses that I know out there, forgive me, but Johnny Hamilton, I will say, was one of the nurses that I would love to be able to spend more time in talking about. She's been in a nursing professional for over 40 years and has devoted her time, and Kaida Phi is the national vice president of the organization and has implemented and presented on so many great healthcare promotion topics, including sickle cell. This is just one of the opportunities that I would love to be able to talk more about her great accomplishments, and as she has been a mentor for many of us in the Detroit area.
Yes, for sure. And she's quite active, and she's in also the Delta Sigma Theta, along with Chi Phi, along with Detroit Black Nurses, and she is very active in each of the organizations.
Yes, she is.
Are there any questions? I'm looking to see if there were any questions from the audience. Oh, we have one comment that it was nice to see how Howard University in Spelman again is in the center of African American history and nursing history as well. Let's see, there's another one. Oh, you had mentioned Natrina Tate, Dr. Natrina Tate at University of Detroit, University of Mercy, Detroit.
Yes.
And there's a comment that says that, oh, from last week's presentation, that African Americans are admitted to colleges more often when there is a dean of color. And with
yes, that is that is true. When we see people like us, we are more prone to feeling the having the motivation and inspired even to take that leap of faith. I think sometimes it can be difficult when we don't see people of color in leadership positions at institutions, and to see that and to have that support, I think that's very important moving forward with the education or for College of Nursing facilities and institutions.
Okay, I don't want to put you on the spot, but would you happen to know which area of nursing is the need the most? Would it be in cardiology, pediatric, geriatric? Before you answer, I'm going to jump right in there. And as a geriatric nurse, meaning me by age, not by profession, we need geriatric nurses. They are so very hard to find. And that's just from a personal point of view. What about you, Alexandria?
I totally agree with that. That is one of the reasons why I went into adult gerontology primary care, was because of the trends and the numbers of baby boomers who will be retiring or have already retired, and there is going to be a shift in care, as it already is present today, in terms of the nursing shortage. And so we definitely need more nurses in the adult gerontology primary, as well as acute care as well.
Thank you. Do you have any advice for any of the students that may be watching today who want to become a nurse?
Absolutely. As a student and as a nurse, I know how important it is to be able to do your research, to be able to look at the different schools and the different specialties, but to also have a mentor within the nursing field. So don't be afraid to ask or to reach out to people. I think a lot of times we're a little hesitant to ask, but it is also very important to be able to learn from our leaders in the field. And then to also stay positive. I know sometimes it can be rough as a nursing student. We have our ups and downs, and it is also very important to be open to new experiences and to be flexible. So I do say for nurses and students to continue to stay positive and to continue doing great work. And joining a nursing organization could also help with networking as well, and volunteering within the community.
Yes, indeed. And must say, from my own experience, nursing has allowed me to travel. It has allowed me to work with peds, emergency room, teaching in the classroom, on the floor. So there's a lot of people that may say, well, I can't go into nursing because I don't like blood. But there are so many different areas of nursing that can afford you the type of lifestyle you would like to have and the ability to just travel and move around.
Right.
When we were asking about which area of nursing is there a need, Nakia Davis says nephrology needs nurses so bad.
Absolutely. I can't forget about nephrology. That's my heart. It's my passion as well. And there is definitely a need for nephrology nurses and dialysis as well.
And Stacy McCarthy says, yes, Nakia Davis, you are correct as well. Most of my geriatric patients have CKD.
Mm-hmm.
And for
Yes.
those that don't know, what is CKD? What are those initials for?
Chronic kidney disease.
Thank you.
Yes, and there is a high prevalence of chronic kidney disease that affects our Black community. There's over 37 million Americans that are affected by chronic kidney disease. However, 90% of those that have it are not diagnosed yet. So that's something that moving forward, screenings, having different community events, and Chi Eta Phi will be having a Kidney Sunday event coming up in March to do screenings, free screenings, kidney screenings, diabetic screenings, high blood pressure screenings as well, and to educate our community on the importance of prevention of chronic kidney disease.
So if a person is seeing their doctor on a regular basis and getting their regular physicals, yearly physical, is that something that would show up, or would the provider have to do special tests or have to hear a complaint before they test for kidney disease?
So usually a provider may, if they start hearing symptoms of, they may start the testing, blood testing for that. So you could test the GFR, the glomerular filtration rate, the urine albumin creatinine ratio are two tests that test the kidney function as well as protein in the urine. So when we start seeing more protein in the urine, we know that there are declining kidney function, and there is support out there. There are medications that can help slow and slow the progression of chronic kidney disease if it is caught soon.
Okay, and Nurse Stacy McCarthy, she also adds that hypertension leads to kidney problems. So, and we know that that is very prevalent in our community.
Yes. Yep. Diabetes and hypertension are the top risk factors for chronic kidney disease.
Okay. Thank you so much
for adding that, Stacy.
Yes. Now, you were earlier talking about for those students that go into nursing that you would recommend being a part of an organization. Can you speak on that a little bit? What is the importance of belonging to an organization, a nursing organization?
Well, I will say that nursing organizations, along with Black nursing organizations, add value in terms of being able to build a connection with nurses that are like-minded and being able to promote health promotion and to be able to have mentoring within the organization. So it does support young nurses as well as those that are veterans in the field to be able to support one another as for example, with Chi Eta Phi Sorority Incorporated, we have different events that promote health promotion. We also have mentoring programs within our organization, and we check on our members of the chapter and the national sorority to be able to make sure that we're providing that support to those that needed them during difficult times as well. So it is hard sometimes to find that support in our regular nursing programs or even at the job. So having those opportunities to find support within nursing organizations is important.
Okay, thank you.
Mm-hmm.
There were quite a few. I'm not sure. Did I ask this? How does the path differ from nursing? Oh, how does the path differ from nurses mentioned in the presentation and those that are working to become nurses today? Back in the early days of nursing, was
Mm-hmm.
it still was it a formal education? Did all the nurses go to school? How were the African American nurses educated compared to the rest of the population that were into nursing?
That's a good question. And we didn't see formal nurse education until the late 1800s because of the slavery era and restrictions for Black men and women to have an education. So we do have a rich history, though, of herbal medicines from our ancestors in Africa who brought those over to us during the slavery era, and that we continue to use to this day in certain instances. But formal education of nursing didn't start until the late 1800s, and Mary Mahoney was one of the first to graduate from a professional nursing school. And so the training began towards that era. And unfortunately, those that didn't get recognized may have had the experience of being a nurse within their community, but did not have the professional licensure of being quote unquote a professional nurse at that time.
Okay, can you share any more history about the Black male nurse?
So there are many Black male nurses and leaders within the field, and we talked more about the president of the American Nurse Association, Dr. Ernest Grant, and all of the great opportunities that he has provided for the initiatives for diversity, equity, and inclusion. And that's something that I would like to add more on Black male nurses moving forward. There was James Durham in the 1700s, who was also known as a doctor at that time, but he was one of the first male nurses at that time. And he pursued a degree in medicine as well. So moving forward, definitely want to make sure to add more highlights of Black male nurses.
Okay, thank you. Are there any other questions in the chat? Do you have any idea of the percentages of male nurses versus female nurses?
I do not at this time, but I will make sure to add that to the information in the slides, and those slides will be available at the end of this presentation today.
Okay, thank you. The history of nursing and the African American nurse is so rich, and there's so many that you could not cover and that we don't even know about. And those
Mhm.
that went from went from their home in the woods up to the big house to deliver the
Right.
babies and
Yes.
nurse the babies
Mhm.
and take care of those that were wounded. So there's a
Mhm.
lot of nurses in our history that will never know their names, but we know that, as you said, we stand on their shoulders. So that was an excellent presentation. And the Gift of Life is saying make sure you sign up at golm.org. Let's talk registration to get the slides. So anyone that is interested in those slides, it's on the screen how you can sign up to get them. And any nursing student, especially, please sign up and get that history lesson that Alexandria gave us this evening.
Mhm.
There's also if we can have the sign up for the health event, the upcoming kidney health event, that will be on March. Well, you can tell us when you're part of that
Yes, I am.
planning process.
Yes. Oh,
There you
lovely.
go.
So this is our flyer for the annual Kidney Sunday event that will also be partnering with Gift of Life of Michigan, Motep Detroit. This will be on Sunday, March 19th. This is a free health fair event. We'll have a kidney education presentation with our very own Nakia Davis, the kidney nurse, as
Yeah.
well as a kidney expert panel, kidney disease screenings, diabetes screenings, blood pressure screenings as well. We'll be partnering with the Wayne Mobile Health. They will be there, as well as the National Kidney Foundation, to be able to provide information to the community. And we look forward to providing this event as a service for humanity.
Thank you. Now, is this the first time that Lambda Chi chapter has put on an event like this?
No, it is. It has not, Janice. This is a staple, a national staple program of our organization. Because of COVID, we had to transition to a virtual approach, but now we are able to go in person, and we are so looking forward to having the opportunity to meet one-on-one with our community again.
So it doesn't matter what state you're in across the country, Chi Eta Phi is offering a kidney Sunday somewhere in the United States in the month of March. That's usually what Chi Eta Phi does, right?
Yes,
And
March is Kidney Awareness Month, so yes.
okay, thank you. Deborah Deering says, great information, Alexandria. Thank you.
Thank you for that comment, Deborah.
And we will have another Let's Talk for National Kidney Month on March 8th. And we will see the sign up for that will come up across the screen. There you go. Ah, it just went away. So, Alexandria, I'm going to call you doctor tonight.
Thank you.
Dr. Alexandria Ballard Sims. That was an awesome presentation. And I hope that it was an inspiration, especially to our nurses, our nursing students, and those that are thinking about going into nursing. We have a very rich history, and the need is great. As the population in nursing is getting older, we're retiring, and I would love to see some young nurses step up to where I was. I was a wound nurse when I was working the last 12 years of my career. And I was one of the first Black wound nurses at the facility I worked at. And I recall when I told one of the nurses, the older nurses at that time, that I was the new wound nurse. Oh, she grabbed me by the hand and took me to every doctor that she could find. This is our new wound nurse.
Oh, wow.
So I hope that all the information that we shared tonight, that it inspires others to go into nursing. Nurse
Thank
Stacy
you.
McCarthy says, yes, Dr. Alexandria Gabriel Sims, you are phenomenal.
Oh, I appreciate all of the sentiments and the encouragement and your comments. And I see one now. Vicky was a former intense. She was a patient under intense transplant care, and she found that the Black nurses were the most helpful to her care and recovery, and that
Oh,
is important. That is important for us to know and to recognize that our patients do acknowledge um, nurses of color and how we are able to provide maybe a culturally competent care, and understanding the culture and understanding what are our needs, compared to, you know, nurses that are not of color, for lack of better words.
Thank you. That was Vicky.
Mhm.
Thank you so much for sharing that, and
Mhm.
congratulations on your transplant. Thank you so much. And
Yes.
that's a part of what MOTTEP does.
Yes.
And if there are no other questions or comments, I believe Tanya Smith is coming back on.
Ladies, that was incredible. That was a wonderful presentation. And Janice, now you know I'm going to ask you, what's a womb nurse? I'm sure there's
Okay,
people out there that want to know. If you could explain that a little bit for me.
yes, it's my credential is wound ostomy continence nurse, which means that as far as wounds, I would see those chronic wounds and make recommendations and actually work on them myself. Ostomy is for the person that has redirected bowels so that they come out in a ostomy on the front, on their lower abdomen, or depending on what type it is, where they have to wear a pouch. And
Okay.
so I was the nurse that measured where the pouch would go, where the opening would go, and give the training. And the continence for those that maybe have a little difficulty with incontinence, not able to hold their urine or bowels, and I would teach that. And so it's a
Wow.
certification, and it was very gratifying. So I enjoyed doing that the last 12 years of my nursing at the facility I worked at.
Wow. Wonderful. Wonderful. I have
Thank you.
learned a lot, a lot, a lot. And I think Vicky says Stacy is saying something. Um, Janice, you might want to
Okay.
mention.
Yes, Stacy. Yes, Vicky. When my baby sister went through a kidney transplant as early as 38 years of age, she had all African American nurses at Henry Ford Hospital, and they were great. Thank you for sharing that, Stacy.
Wonderful. Ladies, thank you so much. Alex and Janice, you guys are wonderful. This has been an incredible last two Wednesday nights. Last week we did physicians and we had Dr. Anita Moncrief from Wayne State University School of Medicine with us, along with Dr. Lonnie and Annette Joe, who are graduates from U of M. They're donor families. They're currently working at U of M. Wonderful conversation. So if you'd like to go back and take a look at that conversation, it is available. I'm sure if you go to golm.org, Let's Talk registration, and say you'd like the presentation from last week as well, we'll send that to you.
Tanya, may I take one more liberty before we sign off? I
Sure.
would like to just say hello, a personal hello, and thank you to Nakia Davis, who we know as the kidney nurse. And she has helped Kiatify over the years with her kidney education, which was her passion. And we're just happy to see her back in action and going to be at our Kidney Sunday on March 19th. So I know she was in the audience. I just want to give a shout out to her.
Absolutely. Absolutely. I've seen her on Facebook and her journey, and we know that God is a healer, and she seems to be progressing extremely well. She gets her treatments and goes to work. I'm like, you go.
Yes.
Yes, excellent, excellent. So we want to continue this conversation. Last year we did nurses, and this year we did the history of nursing again. I just think it's so incredibly important to share what we as a community can do in serving our community.
Right.
So
Yes.
we do have a few announcements. As we all know, March is Kidney Month. And I'm sure if you went to the National Kidney Foundation website, they'll have a ton of opportunities for you to learn more about kidney health. But we here at Gift of Life will have a Lux Talk, National Kidney Month on Wednesday, March 8th at 2 p.m. And I believe we have some wonderful guests, Sonia Cook, Jocelyn Reed, and Tanisha Martin will be sharing their stories. So just go to golm.org, Let's Talk registration. And we'd also like to share a little bit about some upcoming MOTEP events. As we are entering into the 13th annual Coots Calendar Jew Transplant Symposium. Our theme this year is the restorative art of transplantation. It takes place at Children's Hospital on that's a Thursday, March 16th. I don't know if you have that. Jennifer has the flyer or not, if she could post that. If not, just go to golm.org/events to learn more about the symposium. And also you can go to DetroitMotepFoundation.org, DetroitMotepFoundation.org to learn more as well. All the information is there. We're extremely excited about this year's symposium. Our keynote speaker will be Mr. Robert Chelsea, who is the first African-American face transplant recipient. Mr. Chelsea currently lives in California. His story is incredible, and we've been able to gather professionals from the Detroit area, Metro Detroit area, from all the health systems to come and share a little bit about the mental aspect of that type of transplant. How does it affect you mentally? Tissue, why is tissue important? I have some colleagues from Gift of Life Michigan that's going to talk about tissue donations, because we really don't talk about tissue a lot. So they're going to talk about that. So it's a wonderful program plan for you. And then on Friday, March 17th, we're going to have like a couch conversation with Mr. Chelsea, and that's going to be moderated by Dr. Hardaway, who is the first African-American plastic surgeon to graduate from Wayne State Medical School. And Dr. Anita Moncrief will be joining her as well for that conversation. Again, all that can be pulled up at golm.org/events to learn more how you can participate. And we're extremely excited about this year's symposium. So please, please join us. And I think we did good. It's 7:29.
And thank you so very much for allowing us.
Again, we want to thank Chi Eta Phi Nursing Sorority for partnering with us on this conversation and sharing such a rich history. And this Black History Month this year has been rewarding for me. I've learned a ton of information about where we've been, where we're going, what we need to do to go even further. And so whatever we can do to help spread the importance of nursing and being an African-American physician, please reach out to MOTEP, and we'll do whatever we can to make sure that that information is shared.
Thank you so much for your support.
Absolutely. Thank you. Thank you for coming, and thank you for doing a great job moderating, Janice. I appreciate it. And look forward to talking with you guys in the future. And hopefully we'll see our audience at our events we've just mentioned. And thank you, and have a wonderful evening and the rest of your Black History Month.